Did you find it on YouTube, Sam? No. I haven't either.
I'm just turning it on right now.
Okay.
We will be starting the meeting in about 2 minutes. Stuart, you all might want to mute. We're still hearing you.
Okay. Good afternoon. Thank you all for joining us today from the Lake Cumberland District Health Department. We are here to talk about the COVID-19 update. Today is August the 12th. We have some members from our executive team that will be answering questions that were submitted this week as well as last week. I'm going to turn it over to you, Sean, and if you want to share some updates before we start talking about or answering the questions rather.
All right. I don't have access to the board. Stuart, is the board updated? Can you give the update?
Yes, I can. Okay, so we are on activation week 23 and 147 days since the first case of COVID-19 was reported in the Lake Cumberland District. For Adair County, we have 2 hospitalized and a total active case count of 25. 192 of those are recovered. 19 of those have deceased, and the total case count for Adair County has been 236. For Casey County, we have 1 person hospitalized, and we have 13 total active cases at this time. 10 people have deceased, and there's been a total of 209 cases in Casey County during this outbreak. Clinton County has had a total of 42 cases in this outbreak. As of right now, none of those are in the hospital. 13 active cases at this time and 1 death. Cumberland County has had 63 total cases during the outbreak, with 0 hospitalized at this time, and a total active case count of 15 with 0 deaths. Greene County has a total of 45 cases during the outbreak. 0 of those cases are hospitalized at this time. 8 of those are active with 2 deaths. McCurry County has had 46 cases during the outbreak. 0 are in the hospital at this time. 10 are active, and we have had 0 deaths in McCurry County. Pulaski County has had 362 total cases since the outbreak began. 3 persons are in the hospital at this time, and we have 68 cases in Pulaski County that are active with 5 deaths. Russell County has had 137 total cases since the outbreak began, with 2 in the hospital at this time. 29 of those cases are still active, 5 deaths. Taylor County has had 141 total cases since the outbreak began. 3 cases are currently in the hospital, 32 cases are currently active, and we have had 3 deaths in Taylor County. Wayne County has had 76 total cases since the outbreak began, with 1 case in the hospital currently, 20 cases that are currently active, and 0 deaths for Wayne County. The district in total has had 1,357 cases since the outbreak began. We have 12 current hospitalizations. We have 221 cases currently in isolation. We have 233 cases that are currently active. We have recovered 1,079 cases, and we have had a total of 45 deaths in the district due to COVID-19. Today, as of 10:30 a.m., we have reported an extra 21 cases. 1 death in Casey County with 2 cases. One of those was a death. Clinton County has 1 case. Greene County has 13 cases today. There has been an outbreak at a long-term care facility. Taylor County has 3 cases today, and Wayne County has 1 so far today.
Thank you, Stuart. I will add that I'm reporting from home today. I'm on quarantine. One of my coworkers or a few of my coworkers tested positive in a cluster in the health department in Cumberland, and I work down there, so I'm quarantined. While I'm not positive, I am quarantined and working from home. We have had a couple of clusters within our own buildings. We had a cluster in Casey County Health Department, and a cluster in Cumberland County Health Department. So even in an environment where we know the employees are being hyper vigilant on observing the guidance, you can still get it and it can still spread aggressively. So it is absolutely no surprise that once it gets into a nursing home or a long-term care facility, how it can spread, because we've experienced it within our own buildings, and we know for a fact we're being hyper vigilant with the guidance. So it's unfortunate, but we're having another cluster in a long-term care facility, and I'm sure that'll be a difficult situation over the next few days.
Okay, thank you both for your updates. I want to remind, are you finished, Sean? I'm sorry.
Yes, ma'am.
I want to remind everyone that if you have questions today, you may type those in the chat box and we will answer those throughout the meeting. I am going to go ahead and start up with the questions. First question is, can the health department address how the positive cases are added to a county's list? There's a lot of information out there on social media and they feel like that may be misinformation.
I'll take the first stab at answering this, and if Dr. Wayman or Stuart wants to supplement my response, feel free. We add a positive case to our list when we get a lab confirmation. Lab confirmed cases represent over 96% of our cases. There are very, very rare instances when a case can be added in what's called as an epilink. This is when someone they're symptomatic, and they've had a close contact with someone that we know is positive, and they haven't been tested yet. This represents about 4% of our total cases that we've had since the beginning. So by far, our cases represent lab confirmed cases. There is an extremely, extremely rare circumstance. It's less than 1% of our total cases where a case can be added as an epilink case, even if they've tested negative. Now, there's a couple reasons for that. Sometimes tests, you just get a false negative. And sometimes people may test negative and they could have been exposed, but just not have enough viral load in their body yet on the day they were tested for it to pick up as positive. Or they could have tested negative and been truly negative and been exposed the next day and then be positive. So there are rare occasions when someone can test negative and still be added. Again, that represents less than 1% of the total cases we've had. So I think that's what people get confused about, is when we add epilink cases. I'm emphasizing very strongly that that's a minority of the cases. 96% of our cases are lab confirmed. So I hope that clarifies things.
Okay.
Dr. Wayman, Stuart, anything you all want to add to that?
No, it's perfect. Thank you.
Thank you.
Well, thank you, Dr. Wayman. That may be the first time in 20 years you've referred to me and perfect in the same sentence. So that's great.
Okay, next question. If a person tests positive, are their entire households listed as a positive case in the county case count? And I think you just answered that somewhat, Sean, but
Yeah, I answered a lot of these questions this morning, so I'll give my answer. And again, if Dr. Wayman or Stewart wants to amend or append or add on, they're more than welcome to. We only add a positive case as we described it above. You know, if you're a close contact of a positive case and you live in the household, you would be considered a close contact. You wouldn't be a case until you've tested positive. So no, you're not added as a case to the numbers that we report until you've tested positive, or in one of those very, very rare circumstances where you would be an epilink. But no, we don't add close contacts as cases.
okay, thank you again.
Just to add to that, Sean, if you don't mind, we've had a lot of questions about the quarantine as far as, and it just dovetails right into this question. So if somebody is a contact of a person who is a case, then a close contact, so which is defined right now is within 6 feet for 15 minutes by CDC, then that person is quarantined. But the contacts of a quarantined person are not quarantined. So they are not contact. They're not considered contacts. The only way they would be considered a contact and be quarantined is if the person who is currently under quarantine becomes a case. So there's been a whole lot of questions and a lot of, I think, confusion over that. And I may not have even explained that as simply as it could be put. So, if Dr. Wayman or Sean wants to add in on that, I think a lot of people still have questions about that.
Thank you.
You will be quarantined. You're a contact to a case.
Okay,
That's the summary.
thank you. This question is about positivity rate, and I think that comes from some of the information you put in the reports that are put out on a daily basis. But can you define positivity rate for us?
Yeah, there's several similar questions. I answered part of them, and Dr. Wayman answered part of them, and then we tag teamed on part of them. I'll take this one. The positivity rate is the number of positive tests divided by the number of total tests. We can't determine a local positivity rate because we have no way of knowing how many total tests have been completed. Doctors' offices and labs are only required to report to us when a case is positive. They're not required to report how many tests they've given. They're not required to report how many tests are negative. So we can't calculate a local positivity rate because we don't know the number that you divide by. We don't know the number of tests. So I can tell you that the state has an estimate that statewide it's a 5.87% positivity rate. So, I would assume that our numbers are similar to that local. Dr. Wayman, is that close to accurate?
That's
Right.
perfect, Sean.
You're doing well today, Sean.
Oh, thank you.
Next question. If a state has 20% positive rate, would that mean in approximately 5 to 7 weeks, most people in that state would have the virus and their numbers would start to decrease significantly?
Yeah, but I think the person asking the question is confusing growth rate. And I know there's a lot of words that we throw out here that people don't use on a day-to-day basis. So it's good that we're answering these. I hope that we explain them in a simple enough way that everyone can grasp it. It's complicated even for us, and we deal with this, so I can understand how people would get confused. Again, the positivity rate is how many people that have been tested test positive, and again, we can't calculate that. The growth rate is what we use to try to predict how many cases they're going to be at a given. The growth rate is calculated. You divide the total new cases, or you divide how many new. I'm sorry.
You're going in and out a little bit as we're talking.
It may be my internet connection. I'll move the microphone, but I don't know if it'll help. But you get the growth rate by taking the total new cases for a day, and then the total new cases for a day, and then you divide that by yesterday's total cases. So it's new cases today divided by total cases yesterday, and that gives you a growth rate. Now, that don't mean a whole lot to people, but I can say that our growth rate right now is 1.0296. Translated, that means that our cases are projected to double about every 33 or 34 days. So we don't use a daily growth rate for our numbers. We use a 7-day average growth rate that kind of levels the numbers so that, one day you may have a real high and the next day a real low. So we take a 7-day average for our growth rate. But right now, again, our growth rate's 1.0296, which means our cases are projected to double over 33.91 days, which is actually better. About a week ago, it was projected to double every 23 days. So, it looks like it's slowing down. We've been releasing more cases daily for the last couple or 3 days than we've been adding new cases. So that's good. That means that maybe the facial covering mandate, maybe people are observing the guidance, and maybe we're able to be slowing it down a little bit. So Stuart, Dr. Wayman, you want to add anything to that? Tracy,
thank you.
Am I cutting in and out now?
No, you're good now.
Okay, I got my microphone repositioned. Maybe that'll help. This is yours, Dr. Wayman, the next one.
Okay. Next one. Can you define the infection rate? How does the infection rate differ from the positivity rate? I saw the news report that UK tested 1,600 students and 12 were positive with a positivity rate of 0.75%. This means in a random pool of people, our infection rate is 0.75%. I understand if staff were included in this sampling, it would have approximately.
They're saying the numbers of their population would be about the numbers of our population.
Yes.
Yeah. All right, Dr.
So
Wayman.
I will just be very generic. An infection rate is the same as an incident rate, which basically means the number of cases you have divided by the population. So if we look at the population of the United States and the number of cases that we've had, it would be 5 million divided by 350 million, approximately, which comes out to 1.4% in the US. That's the infection rate. For Kentucky, that would be 36,000 cases divided by approximately 4 million, which is about 0.9%. In the printed version that you will receive, you will get more precise numbers for the world, the United States, Kentucky, and Lake Cumberland.
Yeah, and right now our rate is 0.65%. So that's one of the things that people will be critical about, is they'll say, well, this has only impacted less than 1% of our population. Why are we making such a fuss over it? Well, you got to look at, even though 1% of the population, less than 1%, it's resulted in how many deaths and how many hospitalizations. And what would happen if that 1% very quickly turned into 3%? Then, would we get, if that hospitalization rate held and this thing more than doubled, even to just 2%, would that be so many hospitalizations it would overwhelm us? So it's really important to watch the growth rate and try to do things to slow it down until we have a vaccine.
Thank you all. Next question.
And I think the positive Don already explained. That's to do with number of tests, not not cases. Cases divided by the number of tests.
So also on this question, just to, this is not a question at all that's been asked, but just for general information, I think Sean, both Dr. Wayman would want to add in here. At this time, all of our schools in the district, the majority of our schools have made the decision to go to virtual learning and not have in-person classes, the majority of the schools. But we do have colleges in our district, and this question, of course, was about UK. We know we have kids from that go to UK, Western, Eastern, U of L, Moorhead, Murray, Somerset Community College, Lindsey Wilson, and Campbellsville University. So our universities are all starting back. Our colleges are starting back. And I know that UK has put out the information that they've had very few positives among the students they've tested, at least at this time. And we have to remember that when you test, that is a point in time. So at that point in time, you don't have COVID, or either you don't have at least enough of the RNA for the test to pick up at that. That doesn't mean that tomorrow or next week you may not. So for the parents out there and the kids that are leaving for college, we just want to implore that you wear your mask while you're away, that you, even though you're with your friends, that you would remember to maintain that social distancing. You would avoid those large gatherings that are kind of the norm at college, and this year they just can't be the norm. Or we have the potential that a lot of infections can happen, and then the colleges won't be able to operate because students and staff will be infected and can become sick, and some people can die. So
yeah, I was on a conference call this morning, Stuart, with the commissioner and a few other health department directors, and there was I don't even remember where it was or which director said it, but the several teachers came into a tech training to learn how to use the technology so that they could teach kids remotely. And someone in that training ended up being a positive case, which resulted in 26 teachers being, I think it's 26, being quarantined. So, that's what I'm afraid will happen in these schools, is that you'll get a positive case in a classroom and you'll end up having so many people quarantined because of that. It'll be difficult for the schools to be able to maintain a consistency. I'm certainly hopeful. I think some of our private Christian schools are still planning on meeting live in person too. So we will certainly find out a lot over the next few weeks, how quickly this spreads in a school setting. We'll be finding it out, on a smaller scale than if had all the public schools gone in person. I personally, I hope that all the precautions work and that we will learn that you can have school without it spreading, without having it become a turbocharged transmission, a place where it's spread very quickly. I hope that's the case. If so, as we move on into the next quarter of school or the next half of school or whatever the thing is, we'll be able to make, we as public health and superintendents will be able to make much better informed decisions based on what happens in some of these schools that are going to go ahead and open. So we'll be watching that very, very curiously with a lot of interest.
Yeah, and we've already seen in different types of sports, whether it be football, baseball, just different types of sports, we've seen clusters of cases happen in those sports. Now, I think that our schools are doing really good with the way they practice and things like that. But we do know that the kids, they get together after the practices where where someone's not there to set up all the regulation type things that they have in the formal practice. So they get together and maybe just play a friend's game, and then we end up seeing that someone becomes positive, and then the friends that are out playing become quarantined, which goes back to meaning that a lot of players on the team are quarantined. So just remember, when we do those things, it goes back and affects some of the other things that we really want to do. So we have to really be careful with what we're doing out there, even on our, on our own time.
Yeah, Stuart, let me say a couple other things about school too before. These aren't even on the list, but we've been dealing with school situations a lot in the last few days. One thing that I've been asked several times is, hasn't the health department reviewed the school's plans and declared that school's safe to reopen? We don't look at someone's plan and say it's safe to reopen. In a pandemic, nothing is safe. We review the plans to see if they're in compliance with the guidance that's available at the moment, because that guidance is intended to reduce the risk, not to make it safe. But we don't approve a plan. We only tell people, yes, this looks like it aligns with the guidance. So no, we don't approve plans, and we haven't declared schools safe. And then the other question, I can't even remember what it was. Maybe it'll come back to me. Let's go to the next question.
Okay, next question. Since we've had a surge of cases in the immediate Lake Cumberland area, what are the main causes of the higher numbers in the last couple of weeks of those cases?
Okay, I'll answer. I do remember what the other thing was. People also ask me, well, we know that kids abundantly aren't, they don't have negative consequences in large part from COVID-19. So what's the big deal? It's not the kids we're concerned about. We are concerned about the kids. Some of them, it will make them very sick. Most of them will do okay. But if they catch it at school, even if they're asymptomatic, then they can spread it on to the community, and you can have a large uptick in community spread. Particularly, you take it home, and if you've got elderly parents, or if you're living with your grandparents, then you're bringing it into a more vulnerable population. So that's more of the public health concern, is if it spreads into school and a lot of people catch it, are they going to take it back to a population that's more vulnerable than the students? So that was my thought about that. All right. So the question was, what's the high numbers linked to? You can see this on our website. We do a little donut chart each day. If you go to our website and click the main COVID banner, we adjust those numbers each day. Right now, I looked at it this morning, and the number one area that case transmission is tied to is within families, which would be expected. Right now, the next highest one is recreation, things like youth football, swimming, kayaking, playing basketball, just stuff where people socialize together in a recreational sense, going to the gym, those kinds of things. That's where our next most number of cases are coming from. Then after that is businesses. And of course, people work at businesses, so they transmit there. Then the next highest one's medical facilities. So again, in a medical facility, we know people are being hyper vigilant at observing the guidance, but that doesn't mean that just because you're doing things to reduce the risk is eliminated. You're still in an environment where you're exposing yourself to the virus very often, and it can be transmitted. So we also have seen that travel-related transmission, now that vacation season is winding down, has dropped as one of our number one areas. It was a number one area a week or two ago. Until today, we had seen long-term care facilities be an area that had really dropped. Now that may change after today, after we have that new long-term care cluster. And it seems like places of worship has slowed. I can't say about places of worship, the places of worship that observe the guidance tend to fare far better than the ones that don't. So make sure you're wearing your face coverings and keeping your distance.
Okay, thank you. Next question. It says, I have a question for this week's meeting regarding the reason you are protecting others when you wear a mask more than yourself. I think there is still some lack of education and communication regarding the risk of contracting the virus through the eyes, which is unprotected for most people. I think that is the primary reason it is important for all to wear masks, preventing respiratory droplets from entering the eyes.
I'm not sure if it was Stuart or Dr. Wayman that answered that one.
I got this one, I think. So the reason masks help protect the other person is exactly because those respiratory droplets are wet and heavy. And so when we speak or sing or shout, we are spewing these out for several feet. And yes, I suppose if you spit at somebody and it goes in their eye, you can certainly get the other person infected. So if you wear a mask, you protect the other person. Now, there have been lots of studies now that show that if both people are wearing the mask, you still decrease the transmission dramatically. None of it is 100%. So yes, that's why in healthcare, people wear also face shields to try and stop some of that. There is no 100% effectiveness unless you just stay away from people who have the disease. Not sure if I've explained everything. Maybe Sean can jump in.
Well, I think it's all about reducing the risk, Dr. Wayman. Nothing is absolutely safe during a pandemic. You know, it's keeping your distance, avoiding crowds. You're just lowering the chances you're going to be exposed the fewer people you're around. You're lowering your chances the less time that you're around others. If you're keeping the 6-foot distance, and if you're wearing the face coverings, and if you're washing your hands, you're lowering the risk each time you do that. And the more of those things you do consistently, the more your risk is lowered. Not 100% safe, but lowering the risk. So when people ask me things, is it safe to go to school? Is it safe to go to church? Nothing is safe. It's just how much risk are you willing to take, and how in compliance are those places with the guidance? You know, are they doing things to lower the risk? So those are questions you need to ask yourself. Everyone needs to protect themselves by individually observing the guidance and encouraging the ones you love and are around to do the same.
And remember, it's great to go into a place, wherever it may be, whether it's church or you went to see a movie or whatever, and you follow the guidance, great, while you're in there. But as soon as you walk outside of the building, you know, you take your mask off and everybody groups up. So don't do that. That you're defeating the whole purpose of how well you done for that hour or 2 hours or however long it was to come back right outside, you know, and group up and get together. The virus is still, outside is better than inside. There's no doubt about it. But you can transmit the virus outside. So if just because you think you're outside, that doesn't mean that you can't get it outside.
Yeah, there is some good looking research that says a vaccine may be coming early next year, maybe in the first quarter of next year. Now, I certainly don't have any inside information on the vaccine industry other than what I see in some articles and what Dr. Wayman tells me. I hope that's true. You know, I hope there's some light at the end of this tunnel that we can switch pretty soon to contain from this containment strategy to a vaccination strategy. That would be wonderful. So let's hope that happens. Let's hope a vaccine is developed early next year and it's being able to be produced in abundance pretty quickly, and we can get it out pretty quick.
Yes, let's do. Next question. A story was on the news the other day of a man that was positive for COVID-19, and his case was released when he had a negative test after his recovery. Why was he reported as a death that had complications from COVID-19?
All right, I tried to answer this one, and Dr. Wayman may have to help me. So from a public health perspective, our focus is on the prevention of the spread of disease. Our focus is a little different than primary care. Primary care looks at the health of each individuals and other things other than just the disease transmission. But from a public health perspective, someone can be virus free. And from our perspective, now they're no longer a danger of spreading that disease. So they drop out of our focus from a public health perspective because they're no longer in danger of spreading the disease. So we would list them as recovered, meaning that they are virus free. That doesn't mean that they have recovered from that disease yet. They still may have lasting complications from having been sick from the disease, but they're not a danger of spreading that disease, so they drop off our radar, even though they're still on the radar of the medical community and primary care. So it's very possible. It's happened several times that someone we've released ends up dying from after effects of the disease, and then we would go ahead and list them as deceased from a COVID complication, but they were released. So I hope that explains it. It can certainly happen that way. Does that make sense to you, Dr. Wayman, or could it be said better?
It does. Basically, release from isolation means we no longer think that person is contagious. And we have the criteria for that, which are that it's been at least 10 days from the onset of symptoms, that they have not had a fever for 24 hours, and that their symptoms are actually improving. That doesn't mean they've totally resolved their symptoms. So yes, you can still have symptoms and be released from our isolation.
And sometimes you can still be very sick from some, you may have went in with some preconditions, and this really complicated those things, and you just may never recover from that.
This is something that I think all of us understand in any other situation, and Dr. Wayman can even give examples. So, I had a grandfather who had Alzheimer's, for instance, and he ended up with pneumonia, and he passed because of that, because he didn't know, he didn't understand to breathe, to cough it out. He did die. The pneumonia caused it, but it was a complication. It was the result of that Alzheimer's. And I think there's many kinds of examples we can give where a person has, they have something wrong with them, that underlying thing, and they die of whatever. Maybe they die of flu, but they had some other something that caused them to have a heart attack. And we can understand this in any other disease. We've seen everybody's seen their own family this happen in their own families. So COVID, it's no different. It's no different than that. And Dr. Wayman can say it better than I can, but it's not any different than what we see in tons of other things out there that cause people to die.
Next question. Have you seen the church COVID-related cases slow down, or are they continuing to be a concern?
They're a concern, of course, because that's a confined space that people stay in for over an hour, and the folks that go to church, on average, their average age tends to skew high. So it's a place where a good number of people in the vulnerable population congregate together for over an hour inside that building. So yes, it's a concern. Now we have seen it go down. I was looking at the numbers. We have clusters right now. We define a cluster as more than one case tied to a certain location. So there's 2 churches right now with active clusters in our area. We've had 11 churches, if I counted right, or 11 churches over the last several weeks that have had active clusters. Statewide, in the report I read this morning, there are 30 churches with current clusters. So we have 2 with current clusters, 30 statewide. We've had 11 church clusters since this began, but it's down to 2 at the moment. So, and again, generally speaking, the churches that follow the guidance they fare much better than the ones that do not. So we certainly want people to observe the guidance while they're at their places of worship.
Next question. It seems there is so much misinformation out there in the media concerning COVID-19. Who do we listen to, and who should we not listen to?
I answered this question when I was pretty frustrated, so I hope it don't come out sounding as frustrated as I was when I was answering it. People want COVID-19 to be like any other disease. It's just not. This is not a seasonal flu. This is a novel virus. It's new to the human species. There's no seasonal immunity. When the season changed from cold to warm, it didn't slow down. It wasn't seasonal in terms of did the weather affect it. It didn't seem to slow it down at all. Right now, on the world scale, I think this morning we were getting really close to 900,000 deaths. And, in our local area, this has impacted 0.7, almost 1% of our population, but a little less than 1%. But it's caused a lot of deaths. On the world scale, getting close to 900,000. And we've still got a whole lot of COVID-19 to go if we don't get a vaccine. 99% of the population to go. And that's going to be a lot of death. Now, obviously, there's some people who have had it that we don't know about, but my point is there's a lot of people left to go to get this. So during a normal flu season, about 250,000 people on a world scale die. In a bad flu season, about 500,000 people on the world scale die. We're already approaching 1 million with this, and it's not slowing. It's not over. So it's going to, vaccine. It's not going to, news. So here was what I wrote. Don't the national news. Don't listen to social media. It seems to me, I don't care if you're liberal or conservative, which channel you watch. They've both turned it into a political issue. And that's unfortunate because this is not a political issue. It's a public health issue. And social media is rampant with people who they're not trained in public health, but they're out there sharing. Don't listen to people on social media. Don't listen to the big national news outlets. Listen to public health. That's our area of expertise. I see people that lean very, very strongly conservative. They want to look at the immediate. They want to look at this has affected less than 1% of the population. Why are we making such a big deal about it? And they just want to dismiss it. And then I see people who lean extremely liberal. They want to look at the projections and be alarmists. Well, the truth is in the middle of all of that. We look at that, 1% population that's been impacted, but it's caused a lot of deaths and a lot of hospitalizations. We've had a 3.3% mortality rate, a 9.6% hospitalization rate. That's for known cases. And right now our cases are doubling about every month. And if, schools start and it speeds up, how many hospitalizations are we going to get really quick? Those are things that we worry about. We don't want to be alarmists. We don't want to say you got to shut everything down. We don't also want to say that we got to treat life like it's normal. We're in the middle of a pandemic. What we ask people to do is be aware there's a pandemic going on. Use some common sense. Social distance, avoid crowds, wear your face coverings. If we can do that, we can slow it down. Keep it low enough to maybe get a vaccine developed, get people vaccinated, and move on. That's what we hope happens.
Okay. Have you seen more people in the Lake Cumberland communities follow recommendations of the governor and health department now than when the virus started? And if so, in what areas?
Stuart might be better at that. I mean, from my perspective, it's hit and miss. Some days it looks like a lot of people are compliant, some days not. You know, we get a lot of business complaints. Seems like they've slowed down some, maybe not. Stuart, what do you think about that?
Yeah, I agree with what you're saying. I think our business complaints have slowed down some. Definitely we're seeing a lot more compliance in major stores, things like the grocery stores, the Walmarts, the Lowe's, places like that you're going. Maybe not so much in your smaller mom and pops where people just run in, like the convenience stores, things like that. But what we hope is that as time goes on, that this becomes a behavior, you know, something ingrained in us to know that while this thing lasts on, that this is what we need to be doing. And I do see people doing that out there when they go into these places. But once again, we know that the vast majority of our spread is not about going into the grocery store. I don't even know really that we're having any of our spread there. We haven't tied anything. We haven't tied a case to somebody went grocery shopping. There hasn't been a case tied to that at all. So, it's the places that you're more comfortable at. It's being with your family, your extended family, things like that, with your friends, playing some sports games out there with your buddies. That's the places that we're seeing this spread. Of course, as Sean alluded to, there is some there at work where people go to work and they're around other people, but those are the places we're seeing it. So we need to remember to follow these guidelines, not just when we're at Kroger, but when we're out playing some games with our friends or having a get together at our house. So hopefully that answered that question.
And we're not letting Kroger or Walmart off the hook. You should be compliant wherever you're at. Because
exactly.
it only takes a second for someone to sneeze on you or cough on you. When we're talking about reducing the risk, keeping your space bubble, going in and out quick, wearing your mask, that's all reducing the risk. There is a risk. Somebody you're walking by will cough on you, and nothing we can do about that. If you just happen to be at the wrong place at the right time and someone coughs on you, all the precautions you take, it's all about lowering the risk.
Yeah, and we have to just do that. Right now we're going to have to do that in every aspect of our lives, unless we're at our own house with our own family there. Otherwise, we're going to have to be conscious of that no matter where we're at.
Okay, next question. I am seeing several businesses in Macquarie County not enforcing the mask mandate. Is the health department getting many complaints about these? And how is the process going to follow up on those complaints?
So I'll take that again. We are seeing our overall complaint numbers go down. But with that being said, there's still plenty of non-compliance out there. Go out. Any one of us could go out at any time, and we're going to see some non-compliance. I think the percentage of non-compliance is much, much lower than it has been, but we do continue to reach out to those people, to remind them of the guidance, remind them of the importance of the guidance, remind them what can happen in an establishment to where you have an outbreak and we don't know who has been in there, and then that has to go public. That can really, really hurt a business. So, this is not all. This is about health. This is about your business's financial well-being also. Don't be that business that we have to put out to the public and say, well, we've had an outbreak here. if you've been to this business, then, you know, you're going to have to consider possibly testing. You need to really be worrying about symptoms. Don't be that business. I mean, you can, that can financially ruin you if you become that business. So otherwise, of course, we still refer complaints to Department of Labor for follow-up on those things. So, but we want this to, you know, we don't want to go out and it's not what we want to do, to go out and just beat people over the head. We want people to become compliant because it's the right thing to do.
Tracy, we might remind people that if they have a question, they can put it into the chat and we'll try to answer it if we can. Last week, we missed our scheduled meeting. We're going to go ahead and answer last week's questions. We are going into those next. We had a emergency phone, well, it wasn't an emergency. It was just an unexpected conference call with the Lieutenant Governor on an issue that she wanted to talk with the local health departments about. And that conflicted with their weekly media call. So we took that call instead, but we are now going to address the questions that were submitted for last week.
Okay, the question was, could the panel address the situation in which a person testing positive for COVID-19 but gets counted as a positive? I have had a conversation with someone who tested negative but was counted as a positive. I also want to know if they retest at another time and the positive test, does it get counted twice? Lots of information there. I'm not sure who's going to take that.
Well, I'll answer the last question first, which is we never count the same person twice, no matter how many tests they have. A person can be counted as a probable case when they have the appropriate symptoms and they have been a close contact to a confirmed case, even if they had a negative test, because the timing of the test is important. And a negative test is often a lot easier to get than a positive test because you have to get a good sample, you have to have enough virus particles.
Yeah, and as I said earlier, you know, we've had several cases identified as EpiLink cases, but they convert from being an EpiLink case to being a lab confirmed case once we get a lab. There's only 6% of our total cases that have remained in our system as EpiLinked cases because either they never got a lab or, you know, we doubted that the lab they had was taken at the right time, or maybe they got a false negative. But 96% of our cases are lab confirmed. So don't think we're just adding a bunch of people for the heck of it. You know, we don't do that. It reminds me of something else that we've talked about before, that people accuse us and the state government and the United States of gaming the data, that, you know, we're just messing with it to make it look bigger than it is. That's not true. You know, in our situation, we know absolutely 100% our cases because, you know, 96% of them are lab confirmed. We know they're positive cases. It's very rare that we would add someone that's not lab confirmed, you know, 4% of the time. And that's only because they're symptomatic, been around someone that was really sick. So we're not gaming the data. If there's some major conspiracy theory happening, the whole world is in on it. There's never been a time in the history of the world when every country in the world agreed on anything. And every country in the world right now is taking this thing serious. Now, they may be doing different things, but they're none treating it like it's not real. So, you know, if this is a conspiracy, it's a conspiracy that is like one that's never happened in the world before.
You know, and also just to say, I mean, there are some asymptomatic people. Usually we keep out of 230 to 250, 60 people, you know, about 47, 48 of those will be asymptomatic. our contact tracers, our people here, our case people, they contact these cases every day. I mean, we know that they're sick. We know that they're having symptoms, the ones that are symptomatic. I mean, they tell us that. We talk to them every day. We're not putting words in their mouth. It's like Sean said just a few weeks ago, you know, we're from here. We live here. And we don't have anything to gain by gaming the numbers whatsoever. It doesn't, you know, we don't get paid extra to game the numbers. We don't, you know, we don't get a thrill out of this. I mean, we don't relish in it. If anyone thinks that, they're very mistaken. I mean, after 147 days of this,
We wish it was over.
I can promise you it has taken a toll on the people sitting here, and it has become a drag on us, and we would love to go back to doing just what we normally do.
Yeah.
Well, we'd love to do that.
Stuart, you used the word asymptomatic. Sometimes people confuse what asymptomatic means. Asymptomatic just means you're not showing symptoms. You know, if you're in our numbers as a case, over 96% of the time, it's because you're lab confirmed. You do have the virus. You are capable of spreading it. You have a lab confirmation. Now, some of those people that are lab confirmed can be symptomatic, and some of those people who are lab confirmed can be asymptomatic, which means they're not showing symptoms. That does not mean that they can't spread it. You can spread it whether you're symptomatic or asymptomatic. But, you know, I can understand how people get confused with this stuff because we toss around words that people don't use every day.
Okay, next question. I also would like to know why one person who tests negative but is classified as positive has to quarantine and another one does not have to quarantine.
I can only speak generally and don't know the specifics, but if a case is deemed a case, either confirmed or probable, they will be isolated for 10 days since the symptom onset to prevent spread. If a person is a close contact, if they are deemed to be a close contact, after we speak to them, they will be quarantined for 14 days from the day of their last exposure.
Yeah, and again, let me just clarify some terms we're throwing out there. We isolate someone who is a positive case. We isolate someone who is a positive case. 96% of our cases are lab confirmed. We isolate them because we know they're positive, we know they can spread it, so they get isolated. Now, who do we quarantine? We quarantine for 14 days people who were close contacts to that case. Those people don't get added as contacts, but as cases, I mean. They don't get added to our numbers as positive cases, but they are identified as a close contact, and they're asked to quarantine for 14 days, which is just about basically the same as being isolated. It's just we use the word quarantine for a contact and isolation for a case. But you stay quarantined because we know you've been close to someone who's had it and you could catch it. And if you catch it, you'd be spreading it. So we ask you to quarantine for 14 days so you don't have the chance of spreading it. Like me right now, I'm quarantined. I'm at home because one of my coworkers had it. I didn't test positive, but I could still, you know, in theory, I could still have it. So I got to wait my time out to make sure that I don't have it. So that's what I'm doing.
And Tracy, I believe, you know, in answering this question here, it kind of talks about, it says, I would like to know why one person who tests negative but is classified as positive. If you'll go back to the very start, Sean answered a question about a very extremely rare circumstance, 1%, where you have a person who can be epi-linked even though they test negative. So there is that circumstance where somebody can be epi-linked. If you'll go back and re-listen to the first, I won't re-answer that question again, but in that extremely rare circumstance, less than 1%, then that can happen.
Okay, thank you for bringing that up, Stuart. Next question. There's still a lot of confusion as to how long someone has to quarantine after testing positive. In general, the public is under the impression that from the day a person tests positive, they should quarantine for 14 days, then get tested, and if they are negative and have no symptoms, they are released. However, recently a person tested positive on July 24th and was released 7 days later. Then a member of the same household tested positive 2 days after the first person was released. Can you clear all of this up for me?
Dr. Wayman's going to answer this, but just first, if you tested positive, you're isolated, not quarantined. So I want to make sure we're using the right words here. So we isolate a positive case. Dr. Wayman, you might explain the criteria for releasing a case from the CDC has changed, and that's confusing. As the CDC has researched and they better understand the disease, they've changed the release criteria. So people may be confused about that. But let people know what's the current criteria for releasing a positive case, and then what's the current rules for quarantining a close contact. Can you answer both of those?
Okay. So first of all, we count the days, how many days a person needs to be isolated, not from the date of the test, unless they are asymptomatic for the whole period, but from the date of onset of symptoms. And that is why if you're tested on a certain day, it may be days after the testing day of symptoms was 3 days before that. So that explains that one. Okay, so the criteria for a release from isolation are that at least 10 days have passed from symptom onset and at least 24 hours have passed without a fever and the symptoms are improving. If the person is asymptomatic, that means they don't have any symptoms, then you do count 10 days from the testing date. And that's why these dates may be different in different people.
All right, that's for positive cases. Now, what about quarantine for close contacts?
Close contacts, if we've decided that that person is a close contact, during their incubation period, that is the time that you may be infected but do not show symptoms. This can be up to 14 days, and that is why people are quarantined for 14 days. So quarantine is for contacts of cases. Isolation is for cases. Isolation is for a minimum of 10 days. Quarantine is for a minimum of 14 days.
Yeah, and it's strange to some people why a close contact would be quarantined longer than a case would be isolated. Well, it's because if you were exposed, it may take 14 days to make sure that you haven't incubated the disease and got it. So it seems a little backwards, but that's just the way it is.
And unfortunately, if you live in the same household with someone and they're not doing that strict isolation, then you've exposed yourself over and over again. So you have to follow that criteria then and do the 14 days after they've been released.
Correct.
So you can go for, what is it, a total of 24 days?
Something like that.
Yeah. So.
Okay. The next question has to do with yard sales. And it says, I noticed the Highway 127 yard sale is proceeding, saying they will follow the distancing and mask guidelines. Does the health department have any new guidance regarding yard sales for individuals in our areas?
Yeah.
We're glad
So
the
just last week,
sale's over.
yeah, Yeah, there may be some lingering yard sellers out there, but just last week we did get some guidance from the governor's office. We did post that to our website, so that is out there for people who wish to yard sale. Again, it's just really good sense. It's really good common sense, just that we've pushed all along about this virus. Please don't have a large gathering of people. Wash your hands frequently, sanitize items, and wear those masks. So, I mean, it's pretty common sense. What has become common sense as this has progressed. I think this is, this is new. This is kind of the new normal that we talk about in some of our some of the media and some of the things that we see. At least it's the new normal for the time being.
When I said I'm glad the 127 yard sale's over, I'm not trying to disparage yard sales. I'm glad that, the fact that there's something that major going on that we're expected to try to monitor. I'm glad that event is over because of the workload it created for us. My father and I are both yard sellers, but he's 90, so I do his shopping for him when I'm not on quarantine, and we're not yard selling or anything right now. So, that's to protect him because he's vulnerable. He's at an age, he's frail, and if he catches it, he probably wouldn't have a good outcome. So, but we
and
do
remember, yeah, just Sean, just as you said, even with the 127 yard sale, we don't see the effects of the things that happen immediately. So, what could have transpired at the 127 yard sale, we won't see the effects of that, not this week. We're probably looking, generally we see, it's usually 3-4 weeks afterwards that we start seeing the effects of the things that happen. So, even though the yard sale is over with, we may have to deal with the repercussions of that in 2 weeks from now.
Yeah. Generally speaking, Stuart, I mean, yard sales, as long as people, the ones that we go to, they're not overly crowded, and it's fairly safe. It's outside. It's not overly crowded. You should still wear your mask and keep your distance from people. Just use the same common sense you use for anything else. Tracy, I'm going to start wrapping up. Are we out of questions?
I do not have any more questions, and I do not see any questions in the chat box.
None yet. So I'm going to wind up, and if anyone's got a question, our live stream is about 20 seconds ahead of our Facebook stream. So I'm going to talk for a few seconds to make sure no one's got a question that they're typing in at this moment. As we're winding down, I will just remind everyone, we would very much like this COVID-19 to be over just as much as anyone else. Until we get a vaccine, we encourage people to do things to slow the spread, keep your distance, avoid crowds, try not to be in confined spaces with people, wear your face covering, wash your hands, sanitize more often around your house. Just do things that you would do to prevent the spread of this and help us keep it slow, the spread slow until we get a vaccine. The only thing that's been posted was a person said thank you again, and you're certainly welcome. We look forward to seeing you all next week. Tracy, you want to wrap us out?
Yes, I will. Thank you all for joining us. We'll be here next week, next Wednesday. I guess that will be the 19th at 2:00. And if you have questions, please send those in. We'd be glad to answer them. Thank you all. Have a good day.
Thank you all.